about 30 seconds. We're just going to give everyone a chance to get into the room. All right, so just open up the room. Everyone's pouring into the room right now. We're expecting somewhere between 300 and 400 doctors and hygienists on this call. Pretty excited. Today we've got Caitlin Parsons. Caitlin is an active hygienist working in California. But Caitlin also is as well as being a dental hygienist, a yoga therapist, a wellness consultant for dental offices, and she helps dental professionals to reduce pain and discomfort in their offices. It's going to be an interesting time when we get back to work. I thought it was really important to have Caitlin on the call because we are going to enter into a more stressful environment, both the patients being a little bit stressed out due to the COVID crisis, and then possibly the staff and the doctor being stressed out. Well, not possibly. There will be inevitably be stress in the offices when everyone comes back. So super important to have Caitlin on here. She's going to share a little bit about, what the hygiene is going to look like when we come back. And then more importantly, some of the practices that she has for offices, doctors, and teams to, operate in the lowest stress environment possible. So with that being said, we have a large number of people into the room now. You can see Caitlin up on your screen in her presentation. With that being said, I'm going to go throw it over to Caitlin. Quick housekeeping items. If you have any questions, please put them in the Q&A box, questions and comments. The chat feature is mostly going to be just if you have any problems with the audio visual or you want to talk to me. But again, questions into the Q&A box. And again, people just into the room. So Caitlin Parsons is a dental hygienist, yoga therapist, and wellness consultant for dental offices. She helps dental professionals reduce pain and stress in the workplace so they can thrive in the operatory. And again, we're going to go into a very stressful environment when these offices reopen with all the post-COVID issues that we're going to deal with. So with that being said, without further ado, Caitlin Parsons, thank you so much for joining us. I'm going to go ahead and throw it over to you and I look forward to your presentation.
Awesome. Hello, everyone. Good afternoon. Like Jonathan said, I am a clinical dental hygienist. I've been working for 12 years, and I'm also a yoga therapist. And a big part of, being a yoga therapist is different than a yoga teacher. It's over 1,000 hours of study versus being a yoga teacher is 200 hours. And a big part of that, me coming to be a yoga therapist, was because of all of the pain and chronic stress that I had in the dental office. And so I'm really passionate about bringing that forward for other hygienists, other dental professionals, because I just think it's so important. So thank you, Jonathan, for having me. Thank you, everyone, for being here. And what I want to share at the beginning is just I'm here as a hygienist. I'm not here as an expert in any of this. I don't think any of us are experts in what we're moving into and what we're experiencing. So I really just wanted to create a presentation for you guys to share a little bit about what I'm understanding, what my office is starting to implement, and then different ways that we can start to feel better in our bodies and our minds as we move forward and go back into the dental office. So, yay! So what we're going to cover today is a new paradigm of dentistry, right? We're going to be talking about just reducing risk in the office and our operatories. We're going to be talking about safety a little bit. Building the team is one of the most important things I want to talk about. And then reducing stress, taking care of ourselves, meditation, breathing, how we can start to utilize that both in the office and out of the office, and then really just whole body health. So without further ado, let's dive in. Dentistry, as we know it, is changing or has changed. When we go back, it's going to look a lot different, just like it has in the past, right? We now wear gloves. That's great. It's going to be shifting dramatically. I was thinking about all of the touch points that I have with a lot of my patients, of just even being able to greet them and shake their hand and give them a hug, and all of that is changing and it's shifting. And I think it's important to recognize and to think about what we do on a daily basis, hour to hour, moment to moment, as hygienists or as clinical professionals, and again, how that's going to shift and how we can start to create that shift mentally before we even go back into the office. We obviously know that now that we're moving into dentistry again, or talking about dentistry again with COVID, there's so many changes we're going to need to make, right? The social distancing, the type of protection that we're going to use, what we can actually use in our operatories moving forward as far as piezo, no piezo, all of that. Are we, as hygienists, as dental professionals, are at high risk? And I'm seeing this all over. For those of you that don't know me that well, I have a Facebook group for dental hygienists. I'm actually making it for dental professionals, but there's over 700 people in there, and we're all kind of coming together and figuring out how we can move forward. And, you know, we're getting all of this data, all of this information from all over the place. But what we know is dentistry is at high risk, right? We are constantly coming into contact with patients. We are coming into contact with numerous patients over and over. We don't know where those patients have been. And of course, when we bring in the whole discussion of aerosols, that's a completely different conversation. So how do we as dental professionals stay safe? And how do we as dental professionals stay safe so our patients can stay safe as well, as safe as we can? Oh, I'm gonna have to move my little screen here. There we go. So one of the most important things is having a plan, not just for you as a hygienist, not just for the dentist, but the whole team coming together. I'm gonna talk a little bit more about that, but making sure there's a plan in place. Changing the schedule, making sure that we're all on the same page, the whole team is on the same page as far as what is the schedule going to look like, how many patients can we actually see per hour, and we're starting to get some regulations coming out in regards to that. But how many patients can we see as patients or as hygienists? And then what does the operatory situation look like? So again, how are we setting up the schedule knowing that it's going to be much different than when we left in March or April? Proper PPE, making sure that we have everything that we need when we go back into the office. Again, this is going back to changing how we see our patients, and you know, in the operatory, in per patient per hour, and then how we interact with our patients, just like I had before of hugging your patients or shaking their hand. All of that is going to shift quite a bit. And this came out from the RDHs today. This was their recommendation. They came out with a bunch of stuff, but this is one of them. Meeting with your coworkers to discuss strategies for opening the practice. Conducted inventory of PPE and sufficient supplies. All dental team members are tested for COVID. Community risk level incidence of COVID-19 is low. Able to maintain social distancing at work. All operatories and work areas being disinfected. Waiting room is cleaned and unnecessary objects have been removed. We're going to get into this a bit. Hand sanitizers available for patients as they enter, thermometer checks, screening questionnaire, designated place for your PPE, and appropriate disinfectant to maintain clean operatories and waiting room. So you can check that out. Again, that's on the RDHs website if you haven't seen it. So team meeting before showtime. This is one of the most important things as a hygienist. I've been in my office for just about 8 years now. And one of the most important things to me as a hygienist is when we all come together as a team, because I've been a part of teams before where it feels like we're all just individual people. And what is so important and so powerful is that we all come together, we bring our puzzle pieces together to really create a cohesive team as we move forward. So what are some things that you can cover in your team meetings? So some people are talking about, my office is talking about, my doctor is bringing us back for a 2 or 3 day meeting. So what are we covering in these 2 or 3 day meetings? Or maybe you have a day meeting, maybe some of us are going back for a week. But like I mentioned before, schedule changes, not even just in hygiene, but definitely in hygiene. Are you going to start seeing people every 60 minutes, every 90 minutes? I know in our office, we're talking about, usually I run, as a hygienist, I run out of one operatory, and we're talking about actually changing it up. So one patient I'm seeing in my main operatory, and then the next one I'm seeing in a different operatory. So again, just what shifts can we make in our schedule so that we're reducing our risk, we're reducing the risk to our patients. Patient screening. How are you and your office going to start implementing this? Whether you're sending messages ahead of time, whether you're making sure every patient is screened before they come in the office, whether your front office is actually calling the patients and screening them for COVID and for their symptoms. Of course, social distancing. So how can you, when you come together as a team and you look at your office and you think about the patient flow as it was, it's going to need to shift. So how can you start to set some guidelines in your office so that social distancing is more accessible or possible than it was before? And this goes same thing, new pathway for your office. So our office, we are lucky enough that it's one big circle for the most part. So we'll be able to fairly seamlessly kind of have a flow for our patients, but not everyone is like that. So if you have 2 hygienists working at the same time and 2 dentists, and you're thinking about all these patients coming in, what is the flow going to be like for your patients? And this goes back to schedule changes for the patients or for the office is, are you going to stagger your, if you have 2 hygienists again, are you going to do one on the hour and then one on the half hour? So just creating and really thinking about from an outside perspective of, if we want to reduce the risk to our patients, we want to keep everyone separated, how does this look like as we move through the office? And going through, I know my office is going to go through probably a lot of trial runs to see how this works, because there's no other way besides actually role playing and doing it that you're going to realize, oh, we didn't think about this, or we didn't think about when the patient has to go to the bathroom and then the other patient has to go to the bathroom as well. New patient protocol. Something that keeps coming up for me is like health history. Usually we do our health history on an iPad. So what is that going to look like now? What is it going to look like as far as our patient walking into the office? I know my doctor is talking about we have like a front desk concierge person where when our patient is here, they text us. I don't know if this is possible, but we'll see. And this front desk concierge actually opens the door for the patients, and maybe they bring them all the way back into the operatory at that time, or maybe I'm there waiting for them. But knowing that we have to change things up, what is the protocol that your office is going to utilize? And in addition to that is payment and recall and minimizing the interactions there. As a hygienist, I set up 95. If my office manager is on the call, she's probably like, how many do you actually set up? But I pretty much set up like 95% of my recall patients for their next visit. So that's not really a big deal. But payment, we are going to have to shift. If our front office, if we don't want them to, or if we want to minimize the interaction with our patients, is there a way that we can bring in the payment into easy payments, so that I'm doing the payment for my hygiene patients, or that we prepay for our patients, you know, we get their credit card or whatever that looks like, but they're paying ahead of time. So again, we're minimizing the interactions that the one patient has with the entire team. So if one patient comes in and they interact with the front desk concierge and me, and that's in maybe the doctor, and that might be it. So we don't have to bring them all the way back to the front to, you know, bring them into contact with someone else. That makes sense? And then waiting room and operatories. I'm already thinking about all the things in my operatory that don't really need to be there. So for those of you that are neat freaks, this is like your golden hour where we get to tidy up the office. And, you know, same with the waiting room, you know, reducing magazines. What are the other things that your patients are touching? I know that we have water and we have coffee available in our waiting room, and that's probably not going to be there when we get back. So making sure that everything's set up, even the chairs in your waiting room. So if your patients are coming in, your waiting room is big enough, how can you start to separate the chairs so that each patient is one on top of the other? I love this one. It's like the game of telephone. If you and your team are not on the same page, your patients are going to be confused. They're not going to get the same message. And then we already need to be, as a dental office, I truly believe we already need to be a cohesive team. We already need to have the same messaging. Never mind added this stress for the team, and then this stress for the patients that are coming in. So making sure you're crystal clear on your messaging so that it's not this game of telephone of he said, she said to the patients, to the other team members, that everyone is in communication. And one thing that's important with this is our office is starting to get together before we even go back so that we're all on the same page about what to order, about what we're telling our patients, again, patient messaging, and everything. So making sure that you're not the only one that has this thought, that if you are telling your patients one thing, that the entire team is on the same page. Safety in the operatory. This is one of the most important things, and I don't want to get, we want to get into it, but at the same time, what is important is that every office feels really comfortable. Every practitioner in every office, every employee in every office feels safe and comfortable and supported in what their office is choosing. I'm not going to sit here and tell you what to do. Again, I'm not an expert in this. I will share what we're doing. I'll share my recommendations, but I think it's really important that each hygienist, that each team member is really heard and seen, and that we're all on the same page. So whether we're going to actually wear coverings over our shoes, or whether we're going to wear hair coverings, whether we're going to use the piezo. I know that my office is not going to use the piezo. I know that that's come out in a few states to not use the Cavitron or piezo. And again, we're not going to use that. And of course, that changes the messaging that we're sharing with our patients. What type of masks? I know that N95 or a other mask with a face shield is needed. So safety is such a big thing, and I don't want to get too into it because I'm not going to tell you what to do. I think that's based on per office, per state, and what you feel most comfortable with. But making sure that, again, you and your team are on the same page, that if you have certain concerns or you feel that you want certain PPE in the office, that you're sharing that with your doctor, and that your team, whoever, and that everyone is on the same page. I see the messages flying off. I'm just wondering what they all are. Moving forward with the new normal. So again, we're going to actually start taking temperature on ourselves regularly as a team and our patients. And I'm not sure how this is going to look, but I know that the doctor that I work for, Dr. Lefebvre, that's something that he's really passionate about. So, and I feel comfortable with that too. And we're actually going to the extreme that we have a TV and a monitor in our waiting room. So we're actually going to post our temperatures every day. So our patients feel comfortable. They know that they are being taken care of. They know that we're doing the best that we can. The next piece, again, is safety. And then this is one of the most important things, is that we can have a plan. We can have plan B. And then what is most important as we move forward is being able to shift and adapt. Because even if we create a plan right now this week for our entire team going back, say, I think we're talking about going back June 1st. So say we got together now and we made this plan, and then in 2 weeks, it's going to shift. I'm sure there's going to be new data, new information coming out. So making sure that although we want to stay organized and although we want to have a plan, that we're able to adapt and go with the flow a little bit. We know that even before all of this, that the dental office is not a walk in the park. I don't know about you guys, but I've been in a lot of dental offices. I worked in mine, like I said, for 8 years, but before that, I've temped in a lot of offices. And there is, in many offices, a low key, at best, stress, undertone of stress in the office, right? Between late patients or patients late, patients not showing up, multiple patients, emergencies. There's so many things that are constantly happening in the office, never mind what's going on with the team or one individual on the team. So what's most important is that we stay organized, that again, we have a plan, what I'm finding really important is connecting to other healthcare professionals, not in a way to get inundated with all the information, but just to make sure you're staying on top of it. Make sure that, you know, you're on the same page as some other offices. Staying in communication, again, with your team, even before you go back. How can you guys all stay connected? And then being adaptable and taking care of ourselves, because we know if we're going back, and this is what I'm about to dive into, if we go back as a hygienist, I don't know how many hygienists are in the room right now, but if we go back with this underlying stress about what's going to happen, and then we have the normal stress of the dental office, that's a lot of stress, chronic stress that's there. And then how do our patients feel if we have this underlying stress and they come in with their stress and their worries and their concerns? It doesn't really make anyone's job easier. So let's dive into that. Without further ado, we know that stress has a huge impact on our nervous system. When we are stressed and we have moments of stress or chronic stress, whatever that looks like, we are worried, or our thoughts are constantly racing. We're inundated with thoughts, right? We tend to get frustrated easier. We tend to be restless. We don't know where to go. We're unfocused and unmotivated because we're constantly, again, inundated. We have all of this information happening in our mind. Of course, there's an increase in blood pressure. So we have the mental, the emotional component, but then there's a huge other piece is that when we have stress in the body, just even an undertone of stress, that affects the rest of our body. So we're talking about our immune system and our immune health, our circulatory system, our muscular system, how our organs function. If we are chronically stressed, our body is not functioning properly. Again, that means our messaging to our patients is probably not clear. Our messaging to our team is probably not clear. Never mind what's happening in our own bodies. So actually, let's do that right now. Let's just take a moment to breathe here, connecting to our calm. Because again, if stress has a direct link to our nervous system, so does, and I'm going to get into this, so does our breath, and so do breathing practices and meditations. We can literally use different breathing practices, so simple, you guys, to shift from a stressed out state, to shift from the sympathetic nervous system into the parasympathetic nervous system. And this is the place, the parasympathetic nervous system, as many of us know, that our body can actually heal, our body can rest, we can literally digest our food. So I'm going to share some tips with you, but just by slowing down, just by using breathing exercises, just by using meditation, by taking care of yourself, you can shift from a state of being stressed to a state of more calm and more centered and more grounded. So let's all just take a few moments here to breathe. So if you're sitting down, I'm sure some of you are on the go here, but if you can close your eyes, I'll have you do that now. And maybe you're sitting in a chair, maybe you're standing, it doesn't matter, but just allow your eyes to close. Or again, if you're not comfortable with closing your eyes, or that's not possible, especially if you're driving, just go ahead and kind of soften the gaze a little bit here. And just take a moment to, luckily you're not speaking like I am because my heart is racing, but notice the breath as it is in this moment. Notice as you inhale and you exhale. Does it feel fast? Does it feel slow?
And Caitlin, I had to mute all their mics, so I'm going to play along with you since I'm the only other one that can talk. So okay. We're all here with you. I'm doing it right now. Luckily, I closed my eyes and I'm not driving, but I like this. Let's keep doing this.
It's always funny to do these webinars because I'm pretty much just talking to me at my computer screen in my room. So thank you for letting me know you're here. All right. So yeah, just noticing the breath as it comes in and out of the body. And typically when we're in a stressed out space, the breath is usually really fast or not as controlled. And then sometimes we feel the breath more in our chest, right? That beating in our chest, or the heart is beating really fast. And what I want you to do is just see if you can, again, bring the awareness to the breath, but just slow it down. So your inhale gets a little bit longer and more full. and your exhale gets longer and slower. So as you inhale, begin to feel your belly expand, feel your rib cage expand, maybe your chest expand. And as you exhale, feel that all kind of soften back. And we're just going to do this a few times here. Super simple way is just bringing the awareness to your breath. So inhaling and exhaling. And if we stayed with this for a while, we could slow down the breath and bring the focus to especially the slowing down of the exhalation. And slowing down of the exhalation, as I'll share in a moment, is one really powerful, really easy way to reduce stress, to become more present, and to bring our body into that rest and digest state just by breathing. And we all know that when we're with a patient or we're in between patients, we have this moment that we could just maybe not close our eyes, but that's okay. We could just slow down the breath. I think I'm going to just pause with that. I don't want to go too far into it. But that's one really easy way, is just by slowing down the breath, just by becoming aware of our breath. We all have a breath. We're all breathing in every moment. It's just whether we're consciously breathing or not consciously breathing. And we know that when we are depleted, when we're stressed, when we're overwhelmed, we can't give our best, right? And as hygienists, as all dental professionals, we have to be really present. And when we're not present and we're depleted and then we're showing up for our patients, I'd argue that the patients aren't getting the best quality care. So what does it look like for you to take care of yourself in a different way? And all of us are, experiencing different things with COVID right now. So COVID and not COVID. So how can you start to take care of yourself more so that you can become more present for yourself, for your team, and for your patients? So breathing practices to find our sense of calm. Let's find some. So one of them is just like what we did, just awareness of the breath. And I'll share with you a link in just a moment, but I actually created 3 practices for you guys: a breathing practice, a meditation, and a little stretching practice that you guys can all do. It's a freebie. You guys can all do in your morning meetings if you want to. So I'm going to share the link for that in just a moment, but there's so many ways that we can find calm. And I think I know it's so important when imagine your whole team being calm and being present and being grounded, and then showing up for our patients, versus this undertone of stress and anxiety, and we're not communicating and we're all on different pages. What patient experience would you want if you walked into the door at your office? So again, awareness of the breath, just, okay, I'm really stressed right now. Let me just bring my focus to my breath. Here we go. Just breathing in, breathing out, inhaling, exhaling. It can be as simple as that. And like I said before, long, slow exhalations are a way to shift our nervous system to that rest and digest, to that parasympathetic state. So focusing on really long, slow exhales, or just focusing on the exhalation in general. I call this one 4x4 breath. I think this isn't the one I shared in your practices that I gave you, but 4x4 breath is you'll inhale for a count of 4. So 4, 3, 2, 1. Pause at the top. So you hold the breath in, 4, 3, 2, 1. Exhale, 4, 3, 2, 1. Hold at the bottom, 4, 3, 2, 1. And if you're new to different breathing exercises, 4 might be too much, or you could do 5. It's also called square breathing, but it's just a way to balance out your nervous system. And again, not only balancing out your nervous system, but it takes your mind in the focus that you were in, maybe the 1,000 thoughts that were floating in your brain, and it brings it into one space. So it brings you into the present moment, which is the breath. The last one is counting the breath. So you could do just an inhale and an exhale. If I am anxious or my mind's racing as I'm going to bed, this is a common one I do going to bed, I just literally take a normal breath in and I just count as I breathe in. So maybe I count 1, 2, 3, 4, 5. in 5, 4, 3, 2, 1, whatever that looks like. You can lengthen it, or you could just simply count the breath. Or you could do another way to count the breath is inhale 1, exhale 1, inhale 2, exhale 2, and maybe you go to 10, whatever you want. So breathing practices are a super simple, powerful way to bring us into the moment, to reduce stress. And just like I've shared here, these are practices that you can do in the bathroom when you're in between patients. These are ones you can do while you're writing your notes. This is one you can do in your morning meeting. You can do it before work. You can do it after work, your lunch break. There's so many different possibilities. It's just a matter of doing them. So meditation obviously helps too. We hear this all the time. Meditation for helping us stay centered, for reducing stress, reducing anxiety, for really being grounded. Because we know that when we go back into the office, if we're not grounded, if we're not centered, if we're not present, and plan A doesn't work, plan B doesn't work, and we're going to have to make up plan C on the fly right there. If we're stressed, plan C isn't going to look quite as good as if we were all calm and centered, right? And what I want to make sure that everyone knows is meditation doesn't have to be even just like this picture right here. It doesn't have to be seated in this, woo-woo position. You don't have to have the plants around. You don't have to have this peaceful garden in front of you. It doesn't matter. Meditation can be just breathing. Meditation, I'm going to share a few practices here, but meditation can be really simple. I also want to share that if you don't know me at all, I used to be very anxious and very stressed out and not flexible at all. Most people look at me and they're like, oh, of course you do yoga, but I can't. No. If I can relax my mind, you can relax your mind. Just want to clarify that. One meditation that we can do that's really, really simple, you can do this in the office, is just grounding. And so I'll do this when I'm standing. If I'm feeling anxious and the doctor that I work for is with a patient and we're, say it's a challenging patient and he's doing the exam and I'm in there and I'm trying to relax my mind and all of this, one thing you can do is just bring the awareness to your feet and just feeling, okay, I'm grounded, I'm present. And maybe you bring some breath into it, it doesn't matter, but just feeling your feet on the ground can be simple. Or walking and just really being aware of how you're walking from your operatory to sterilization or to the bathroom. It can be really simple. Again, you're just bringing the focus away from what's here and into something else. So when we do that, the goal isn't to stop all of our thoughts. And in fact, that's why a lot of people stop meditating. It's the focus of, or the point of meditation is really just to slow the thoughts down so that we become more present and we don't get taken away by our thoughts. A breathing meditation, just like I shared, counting the breath. You can do that for a while. You could imagine your thoughts like clouds. That's one that I actually really like, is just, okay, if I was sitting here and I'm thinking about all the thoughts that are coming in my mind about safety, about PPE, about the schedule and all these things, I imagine each thought as if they were a cloud. And I imagine these clouds above me, and they constantly keep adding clouds. And then I imagine the clouds above me, my body, and then I just imagine lifting above the thoughts. And then when there's no thoughts or there's less thoughts, it becomes way easier to make decisions, to act quickly, to respond. So that's another one. Meditations can be done in the morning. Meditation can be a quick meditation, again, in between patients or at the start of your day in your morning meeting. Or if you guys have weekly team meetings, you could do it for 5 minutes at the beginning. Another one that I find so valuable is nighttime relaxation. So one of my favorite things is listening to a meditation, if not as I'm going to bed, before I go to bed. And sometimes this can just be, okay, relax my shoulders, relax my jaw, like a body scan. But going to bed and finishing your day in a relaxed state, you wake up completely different than if you went to bed with your thoughts racing. We know that sitting is not ideal for our bodies. This is kind of the last piece here. We're reducing stress, finding our calm, but sitting every day, never mind sitting and twisting or, you know, holding the suction with one hand or the hand piece with the other, depending on what we do in the office. Sitting is hard on the human body, never mind everything we're doing in dentistry. Never mind added stress on top of that. So sitting in general causes tightness and tension in the body, right? We know that. It causes muscular imbalance. So certain muscles, especially if we're twisted, if we're leaning forward, if we're hunching, or if we do like the side lean, that's one that I'm really good at. It creates imbalances in the body. It decreases because we're getting areas of tension, of tightness, and muscular imbalance. Our circulation is not flowing as it should. With that, you're going to get more inflammation because everything is stagnant. And this is what leads to pain and discomfort. And we know how many of you are feeling so good right now, not working in the dental office. I don't know about you, but that is me. When we go into the office, say on a Monday, and imagine going in feeling like, tight and tense and not good in the body. Or imagine going in on the days that you're like, I'm ready for the day. It's a completely different experience for you. Then it's a completely different experience for your team and your patients. So making sure that you're taking care of your physical body, because when we have pain and discomfort, again, just like stress, we're not focused, we're not present. It's way easier to get distracted, to be more irritable. So imagine, say you have 10 people on your team. Imagine those 10 people came in with no stress, feeling good in their bodies. And again, how you'd all interact, how you'd interact with your patients versus the experience of all of us coming in with an undertone of stress and an undertone of just like achiness in the body. And then how we'd show up for ourselves, for each other, for our patients. Completely different experience, right? So some things that really help me is just movement in general. So when I'm out of work or even in work between patients, making sure I'm moving throughout the office. Morning and evening routine is huge for me. I literally wake up in the morning and I know I feel my best if I stretch. And oftentimes, you guys, I stretch in bed. It can be that simple. But making sure that you're stretching the areas of your body that are tight. So since most of us sit like this, we want to make sure we're opening the chest. Since we're sitting, we want to make sure we're creating space in our like hip flexor area, our back, our legs. We want to make sure that we're strengthening and again, balancing the body, meaning if we're hunched over, if we're twisted, if we're leaned to one side, our body is going to be completely distorted. So making sure you're doing practices on a regular basis that support your whole health and whole body. And again, as a yoga therapist, of course, yoga therapy is one of the most profound things for me. I created an online program I'll share just a little bit about, but to help you stretch these areas that get really tight, which of course is neck and shoulders, hands and wrists. The low back is a big one, our hips, and then just our lower body as well. So stretching, strengthening, so you're creating more strength, especially on areas when we're tilted to one side, making sure that we're strengthening the other side of our body so we can find that balance again. Yeah, that's one of the most powerful things for me, but there's so many other ways that people feel good in their body. So I'm not suggesting that yoga therapy is the only way, but I do know that it works for many people. And really, it's all about you, what works for you, and taking time for you. So breathing, stretching, at work, out of work, doesn't matter. Meditating, or whatever that means to you, slowing down. That could be Tai Chi, that could be journaling, that could be reading a book that's really relaxing, that could be drawing, exercising. I know that movement is so beneficial for me, even if I leave work and I'm like, I don't want to work out, I don't want to do anything. When I work out, when I exercise, I feel so much better. Of course, eating healthy, drinking plenty of water, these are all so important for feeling good in the office. Here's that freebie I was talking about. Again, it's a meditation, a breathing practice, and quick stretches for your morning meeting. So I know our morning meeting is 10 minutes. So the breathing exercise and the meditation are, I think, 6 minutes, 5 minutes, if you take out the talking a little bit at the beginning. And then the stretches are, I think it's a little bit longer, like 8 minutes. So these are practices that you and your team, or just you, can do in the morning just to, again, relax, get present, get prepared for the day so that you can show up more powerfully for your patients. So this is the link for the freebie. If you want to take a screenshot, take a picture, anything like that. You can also, on the next slide, I'll have my email address. So if you want to just email me and ask for it, I can send that as well. But I just created this as an opportunity for you, for your team to come together, to feel better, because we know that when each individual on the team feels better, feels centered, feels safe, that the experience for our patients and that our overall, what we're getting in the office is going to be so much better. And these are just opportunities for those of you that are looking to expand. I have a free Facebook group for dental professionals. Right now it's called Freedom for Hygienists. Obviously that's free. That's just, I share different tips, different tricks. I just started implementing my Tuesday team tip, where I'm just sharing, different things about being in the operatory and how we can improve our posture and our ergonomics and how we can reduce stress. I have a monthly membership space where you get a couple of classes a month, all yoga therapy. So that's the link for that. And I also created an online program about a year ago, actually, and it's a 3-month program that gives you weekly yoga therapy classes that help to build strength and flexibility in a really continuous, progressive way, and it's for anybody. So my email is on the bottom. I know some of you will have some questions about maybe what I shared. I'm more than happy to, I'm sure we'll have some questions here. I'm more than happy to stay and answer some of your questions and kind of talk a little bit more, but if you can and you want any of this information, go ahead and screen share or screenshot it, take a picture, whatever works for you.
Caitlin, that's absolutely awesome. So yeah, there's about 20 questions in the queue, so we'll go ahead and cover those. And I had a lot of questions and comments that come up as I was making notes as we went through. Great information. Do you guys do this in your morning huddles every day, or periodically throughout the day? Do you pull people aside for a little bit of calming and meditation?
So we have morning meetings every day but Thursday, just because based on our schedule. And I think we're going to start utilizing this a little bit more, the breathing and the meditation. We've done it in our weekly meetings. We've done it in our monthly meetings. I definitely have, most of my team will come to me and like, my shoulder hurts. Can you either massage it or can you give me a stretch that will help it? Or if we're feeling stressed, sometimes the best thing that I can do is just me being calm and present, because if I'm calm and I'm present and someone on my team is freaking out and stressed out, I think just the presence of someone else that's, more grounding, more calming can just be enough to not tip you over the edge and have you keep going. Does that make sense?
Yeah, definitely. And someone's actually asking, how did you become a trained certified yoga instructor / therapist?
Yeah. Well, like I said, my story came from, when I first became a dental hygienist, I was 21 years old as a registered dental hygienist. And almost immediately after, of course, getting out of school, I had a ton of loans. I worked like 6 days a week. Anyway, I had a lot of pain in my body, which pain for a long time and chronic stress and anxiety. I was depleted and I was like 22 years old and not taking care of myself. Anyway, walked into my first yoga class and it's completely opposite of what I teach now. Is a Bikram yoga class, like really fast and hot. And anyway, I just started to feel better. And that led me to more yoga, my first teacher training. But I knew when I started experiencing pain in my body, and I knew when I started to teach or to take yoga classes and I started to feel better, I remember one day just being like, this is my mission, is not only to heal my body and to feel better in my body, but if I'm 21, 22 years old and I feel like crap like this, imagine being in this field for 20 years, for 30 years, and how that will affect it. So I knew that my mission was to help dental professionals. So if you have specific questions about my actual certification, I'm more than happy to answer maybe outside of this, but a certified yoga therapist, there's schools throughout the United States, throughout the world that you can get certified in.
Perfect. So there's about 20 questions in the Q&A, so we'll go ahead and tackle some of those. I do want to let you guys know that Caitlin's information's here. She is welcoming emails and questions. So if you see a link or you have questions on that, or you don't get your question answered today, you can go ahead and put it in an email to Caitlin and she'll address that. So Caitlin, Anonymous says, I'm from San Francisco and we're mandated to still shelter in place until May 31st. Emergency treatment is only recommended, but my office wants to reopen May 15th. What are your thoughts about this? And to be fair, if you don't want to answer a question or you don't feel that you're in a position to answer that question, you don't have to. Yeah. But just as an employee of a dental practice, you can kind of address it how you would approach it.
Yeah. I know that I would not go back to work until I feel safe and that I feel like I've communicated to my employer of what's going on and what I need in order to feel safe and all of that. I know that if we were mandated, if my office was opening on May 15th and we were not mandated to go back by the state or by the city, I don't think I would. And that's just a decision that I feel comfortable with. I think that's a per person basis. Yeah.
Yeah, and this question's come up on other calls. I don't think that all offices are going to be opening that quickly. And if they plan to, that might have been based on, as Caitlin addressed, the plan A that became the plan B and became the plan C. So I would, watch those situations as they get closer, see if it's actually going to open. But then Caitlin, tell us a little bit about the communication that you've had with your doctor and your team. You guys have kind of been openly communicating throughout this entire situation.
Yeah. Like I shared before, communication is so big for me on any level. So the doctor that I work for actually created a Facebook group for us. So we stay connected through that. We've had some emails back and forth. I've actually done a couple of webinars with the doctor that I work for with Jonathan here. So we've talked back and forth about, what my concerns are moving forward, what his concerns are moving forward. So there's so many different ways to stay connected. I know for a lot of people, I think the biggest challenge is feeling disconnected from your employer, from your team. So making sure how, even as a hygienist, how can you start to rally and bring things together, or maybe reach out to your employer and say that you want to have a conversation, because there's many different ways that we can do it. We can just connect via email. You can maybe have a Zoom meeting. We can still meet via Zoom, right? We can still have conversations, and it can just be really simple of okay, what are the things that we're starting to purchase for PPE, or what do we want to start to implement, or when are we going to start, when are we planning to go back? Starting to get some information, I think is important, and keeping the lines open.
And Caitlin, does your Facebook group, is that a discussion page for hygienists about situations they're facing like this, or is that just yoga based?
It's a lot of yoga therapy and health and stress, but I do want it to be a place where people can also share and have discussions like this. So I know there's a few other Facebook groups that are a little bit more out there for venting or for discussion, but I'm more than happy to open it up in my group too.
Perfect. And then this question kind of correlates with that. Marcy says, how do we respond to doctors that are not adhering to the new guidelines? I'm in San Diego. We are not recommended to open. I have friends that have been told they have to return back to work today or lose their jobs. And then 4 question marks. I called the Dental Society and they said they don't really have any authority to tell them that they cannot open.
That's a tough question. And I think a lot of us throughout the United States are facing that. Is some offices are opening right now or have already opened, and some aren't, and kind of my office is playing it by ear and seeing how things go. But I know that I would probably I wouldn't go back right now. So I would unfortunately take the risk of losing my job because I don't feel safe, and I don't feel safe to support my patients.
Definitely. And then, Caitlin, what's the verdict on using ultrasonics during the cleaning visits? I did share with you that we had a call earlier this morning where some hygienists had said that it was a state mandate that they could not use the ultrasonic for the visit. So two things, not that you know whether it's allowable to be used in your state or not, but what are your personal feelings on the ultrasonic and the aerosols?
Yeah, I think this is a per state, per office even. I know that for now, as of now, my office is not going to use the piezo. Anything that we can do to reduce the risk of spreading things, we're going to do. So I feel confident in my ability to keep my patients healthy without just using the ultrasonic. So that's what we're going off of, but I'd say just pay attention to what's going on in your state. Do what feels comfortable for you, for sure.
Perfect. And, and one of the things, we do have a lot of doctors on this call, and I did say it on the call earlier that, there's a lot of concerns about the hygienists. There's also a lot of concerns by the doctors. So, the important thing that Caitlin referenced is those meetings, those conversations with your doctor. I've been on calls with Caitlin and her doctor, and, she said, there was some tough questions asked in the Q&A, and she said, well, I would have a talk with my doctor. And it was, not startling, but kind of funny that, yeah, they have that rapport that they're going to have a conversation. She's going to go to her doctor and say, these are my concerns. I'm going to lay them on the table and let's kind of address them together, because there's a lot of concerns on the doctor's behalf and the profitability of the hygiene department and not seeing as many patients. As we all know, these patients are paying per visit. So it's going to be interesting as we go back. And I think it's going to be a little bit of a give and a take to find a happy medium and get to the new normal in the office. So I think everyone openly communicating and everyone having an understanding for each other's position is definitely going to help as we move forward.
Yeah. And just, do you mind? Oh, sorry.
Please go ahead.
I was just going to say, it's so important that everyone is on the same page again moving forward, because if you don't feel comfortable with what you're doing, your office is not going to be able to thrive and be able to get through everything. Again, if one person or two people are like, hey, but no one even listened to me, I don't feel comfortable, I don't feel safe, everything's just going to run differently if everyone's on a different page. Yeah, I think that's just what I was saying.
And Caitlin, Anonymous asks this question for you. How do you make the front and back office be more supportive of hygiene when they think that we're overpaid as hygienists?
Ooh, I feel like that's a struggle that almost every dental office, it's like the front and the back. I feel lucky in my office that my team I would say our team supports everyone on the team. I think we are all extremely, extremely valuable. And it doesn't matter how much any of us get paid. And in fact, I feel like I'm valued in my office beyond my pay rate, because I also show up to help other people in my office. I'm not just going there and when I don't have a patient, I'm just like reading a magazine or pretending to check my patients for the next day or just stay in my own bubble. I'm actually going to the front office and I'm asking, can I make continuing care calls, or can I clean your room, to the dental assistant? So I think that's a deeper issue that I don't know how to address, but I just think making sure that we're all team players is so important.
Yeah, I agree. I mean, it's definitely a team effort. There is different compensation throughout the office. It kind of is what it is. There are a lot of people that start in dental offices and then go to hygiene school to become hygienists, and that extra training and being an RDH is what you're being compensated for. So it is a little bit difficult, but I would think the offices that have that issue, there's probably a more systemic teamwork issue that needs to be addressed, and being a team and producing as a team. So that would be my comment. Caitlin, can we see your email address on the screen? So it should be at the bottom. Caitlin can also type it into the chat for us.
It is at the bottom. You can see support@caitlinparsons.com. Do you see it?
I do, yeah. So everyone's at the bottom of your screen. It should say that support@caitlinparsons.com. Caitlin, what do you think of surgical caps and not the disposable ones?
That's something, honestly, that I'm dreading having a deeper conversation with my doctor on. You can tell I probably am going to have to wear a cap. I don't know what that looks like. I don't know if he's ordered them. We've talked about them. On our last webinar, we talked also about shoe coverings, and he feels comfortable, the doctor that I work for, being he, feels comfortable not wearing shoe covers, and that his shoes are his shoe covers, and he's leaving his shoes at the office. But hair is definitely another beast, so I'm not sure what we're going to do moving forward, honestly.
Perfect. And someone's asking on the opportunities page, what does it mean for the 3-month program? It says 25%. I assume that's 25% off with the COVID-19 code. Is that correct, Caitlin?
Yeah. So it is a 3-month program. Again, it's every week you get a different yoga therapy practice. Oh no. What happened?
That's okay.
All right. And right now, yeah, it's 25% off if you use that discount code. And yeah, there's actually over 50 something practices in there, classes, meditation, all of it. And it's all based on the main areas that dental professionals experience pain in their body. So if you have more questions on it, you can, there's more information at this link, but you can also send me an email if you have questions. It's 25% off.
And Caitlin, it looks like we're probably going to have PPE specialists in these offices as we go back. If there's someone in here on here, whether it's a doctor, a hygienist, or a staff member that wants to be the calming specialist once they go back, they can reach out to you and you guide them through putting a program like that into the practice for morning huddles.
Oh my God, I would love that. Yes, heck yes.
So yeah, you guys can all reach out to Caitlin and she can help you with that. Where do I find this recording on your webpage? So I'm going to put this on iTunes tonight with Caitlin's permission. And then I'm also going to share that link to that with Caitlin. And then I'll also share the raw video and audio with her so she can put it up on her pages if she chooses, instead of just linking it to my iTunes. Caitlin, we talked a little bit about, the hygienist and the interaction with the patients. And I can tell you that, I used to have a friend of mine, Sarah, and she would always bow and say namaste. And I used to think that was a little interesting because I still don't know what that namaste means, but hugging patients, shaking their hand, do you have a new protocol you're going to put into the practice?
We will have a new protocol. I don't know what that looks like, but I definitely don't think it's hugging our patients, and I definitely don't think it's shaking their hand at this point, unfortunately. So, and
there's probably going to be a lot of communication that something, and I think, to cut through the awkward, there's probably the communication that goes out before the visit, kind of saying like, this is what we're putting in as far as PPE, and this is kind of some of the protocol we're going to use. And I think in reading that, they would know that, it's a different way that we interact in the office. We might not do the hug and everything we used to do.
Yeah. And I mean, that's one of the things to discuss if you're going back ahead of time and having these team meetings is what are you going to share with your patients so that they know how to approach everything, how to walk in your office, are they going straight back into your operatory, or are you going to have them hang in the waiting room like they used to? And just making sure that your patients understand what's happening. So, and they know that it's for them. They know that you're doing all of these precautions so that they feel safe and they feel at less risk when they come in your office.
Excellent. And then, this morning, I think I shared with you before I called that someone mentioned that the Hygienist Association was suggesting a 90-minute appointment time. And are you going to see more patients? And do you need more patients if you're not using the ultrasonic and your hand scaling? What's your perception of how that visit's going to look for hygiene appointments?
As of now, I thought that my office was it was before this came out, but my office was going to do still the same 60-minute appointments, but utilizing a different room as well. So one patient is in Op 1 for an hour, and then the next one is in the next operatory. So you're reducing, again, everything that's exposed, all the aerosols and all of that. So if it is mandated that we have to do 90 minutes, we're going to do 90 minutes. So we're going to, I think, wait a little bit on that till we get more information.
And then, I had a call. I was with Dr. David Rice with Ignite Dental on Friday. We had an interview, and he said that his hygiene protocol is going to be to have the patients in for the hygiene appointment. And then as far as the exam, it's going to be an intraoral camera and a recording. And then he's going to do all those later on in the day
Mm.
because he didn't want to have to change his PPEs and jump back and forth for the exams. Someone did question whether you can bill it the same given that protocol, but what do you think about something like that? So there isn't a lot of, moving parts in the practice. So it's a singular visit, they're in with you, and then you take a recording of that for that exam later.
Yeah, I'm curious what they meant by recording, but we use intraoral photos. I use them like all of the time in my hygiene visits. So when the doctor comes in, it's actually really streamlined, and everything's really set up for them. So that's something that I don't do recordings, but we have a Diagnodent. I use an intraoral camera. We have a carry view as well. So if there are concerns, the doctor usually knows anyway beforehand. So I'd imagine that is going to be something that we'll implement, but I don't know. I definitely don't know the billing aspect, and I don't know if that will be the same for every patient, or I'm sure there's going to be some instances where they do have to come in and actually clinically diagnose. You can't see everything just based on a photo, and we don't know different symptoms and cold testing and all of that. But I think utilizing intraoral camera and any technology that you have is going to be super important and make things a lot easier.
Definitely. And someone's asking, what is the hygiene Facebook group page again that you spoke of? And can any hygienist join this group?
Yes, any hygienist can. It's called Freedom for Hygienists. I'm changing the name, and I'm actually expanding it beyond dental hygienists. So if you're a RDA, DA, dentist, you can still join. And again, I'm going to change the name, I don't know, next week sometime, and expand it to all dental professionals. But yes.
Excellent. Someone made the comment, I believe the dentists who are opening are driven by financials and probably took a PPP loan, and the clock is ticking. So there are a lot of different things happening with that PPP loan. And again, state by state, it varies. People on this call all over the country. So we're not really sure when people are looking to open, and then I would rely on, start with the local dental society and then your state dental organization and then the ADA. Even if you're not a member of that organized dental group, I would definitely follow their lead as far as when you reopen your practice. Should the doctors provide our uniforms if we'll be required to change in the office?
I don't really think that's something that I'm going to yes or no. I know that my doctor up until this point has provided, like he's the one who does provide what I wear in the office. So I would imagine that I don't even know if he's on this call. I'd imagine that he is going to, but it also depends on, I've seen both sides of it, and I understand both sides of it because it is quite an expense for the dentist and the dental office. And at the same time, as a dentist and as a dental office owner, I would imagine that the health and the safety of your team and that therefore your patients is huge. So I think that's a conversation to be had per team, and I think that's all I'll share.
Yeah, you can leave it at that. And there was a call someone this morning that commented that there's one important variable to this, that PPEs are not going to be easily accessible, especially as we move closer to opening. And a lot of dentists have said, I'm doing the right thing, Jonathan. I'm letting these PPEs get to the front line, ERs and medical clinics that need them to fight this COVID virus. And then as we go to reopen, PPEs are going to be acquired quite rapidly. Someone made the comment this morning, and Caitlin, you can comment on this. They said, I'm comfortable with the PPE my doctor placed, and I don't want to go back to work with those. I want something different. And you're probably going to work that you and your office have right now. But what are your thoughts on that? The PPEs not being agreeable, because of information coming from so many different sources as to what's the right thing to do, and then this person not agreeing with what the PPEs that the doctor put in place.
Yeah, I mean, it comes back to communication, I think, I know that if I don't feel comfortable with what is provided and my office was not taking any of my input, I think that's a decision that every employee can make, an employer can make. I think it comes down to communication and making sure you're on the same page, and making sure that even before all of the PPE is ordered, that again, your team has a conversation, or maybe just the hygiene department comes together and kind of figures out what everyone feels comfortable with. But that's going to be a per patient or per team, per employee basis, I would say. But if I don't feel comfortable, I don't want to work. I know that.
Perfect. And then, yeah, it definitely comes back to those communications. And my suggestion is start having, if you're a doctor or you're a team member, open up that communication now, ask for a Zoom meeting or a one-on-one meeting. If it's regarding something really personal, then I probably wouldn't do it through a group team Zoom meeting, but ask for a one-on-one call with the doctor and just, start having the conversations out. It's going to help you come back strong as a team when your offices reopen. Somebody's asking, or somebody's statement is, we are using a handheld ultraviolet light to disinfect PPE in 2 minutes to allow going from room to room. So do you feel strongly about the ultraviolet lights, Caitlin? Is that adequate?
I don't know too much about it, so I don't have too much to say, to be honest.
What about thoughts regarding HEPA filters in the office or something to eliminate some of the aerosols? Do you have any thoughts on that?
I don't have too many thoughts. I know that's something that we are starting to look into as well. I think actually this week, this Wednesday, Dr. Paul and Dr. Mike are going to be adding more about like what to order or different. I know last week we talked about air filters. Yeah, I'm not sure what we're doing. I think we are getting filters, but I'm not positive.
All right. And we'll have an equipment rep on next week to discuss some of the latest PPEs that are being suggested. Again, we don't want people to spend a ton of money on things that are going to be really costly and plus potentially not needed. But at the same time, we want people to access the PPEs and have them so when they open the offices, they're ready to go. Anonymous asks, what if a patient needs an SRP? Perform only hand scaling? ?
I know. I don't know. Yeah, I don't know that I definitely don't feel 100% comfortable just doing hand scaling on some of, on SRPs and some of the more challenging cases. So but then is doing treatment or waiting to do treatment for 3, 4, 5, 6 months better for them, or is actually getting rid of the bacteria and doing what you can without the piezo more important? And I think that's again per hygienist, per office decision.
Perfect. And then Sabrina's asking, what chair do you personally use, Caitlin? And do you work standing every so often?
I have a chair that is creaky, and I don't know why I haven't gotten a new one. I use a regular chair. I honestly think it's really important. I mean, there's great ergonomic chairs. I've used the rollerball kind of thing, and I liked that. At the end of the day, if you have poor ergonomics or poor posture, you can feel like crap in the best of chairs. So making sure that you're taking care of your body, again, you're stretching regularly, the areas that get super tight, the sides of your body that get super tight, and you're strengthening the other parts of your body. So you can actually sit up straight for yourself and not rely on just a chair. Granted, there are some really great chairs out there that I know support a lot of people and people feel better with them. I use a regular one. At the end of my weeks, at the end of my days, it doesn't always feel great in my body, but I do the best that I can. So I've seen so many people use like really bougie, fancy chairs and use them incorrectly and still experience pain. So I don't think it's one of those miracle pill kind of things.
And Caitlin, Marine's asking, are you going to be using a shield?
Yeah, I know. If we don't get N95 mask, and that all depends on, like, some offices are waiting so the front lines actually get the masks that they need. So either N95 mask, or we're going to use a mask and a face shield.
Perfect. And have you heard in regards to whether staff should remove all PPE or just gloves when moving instruments to the sterilization area?
I'm not sure.
Yeah, so that's probably something that's coming down the line, but we'll get a PPE specialist on next week. How often should we be taking the temperatures during the day / appointment / on the employee's employer and the patient? So do you think intermittent temperature taking throughout the day?
I think we're just doing it daily. We are just doing it daily. And then each patient will get, we'll check their temperature every day as well when they come in. I don't think we're taking it more than once a day.
Here's a tough one. Tomorrow says, what do you recommend for a slipped rib that keeps happening?
Oh, email me. I don't know. It depends what's going on outside of that, I'd say.
Perfect. So they can email or reach out to you. And then just a couple more questions. We're almost through them. What do hygienists expect when it comes to isolation? Isolite, dry shield, high volume suction, and assistant?
Yeah, so at my office, I don't have an assistant, and Dr. LaFave, my doctor that I work for, just ordered the, what is that one called, Jonathan? HUVAC? No,
You got me stumped.
Yeah, I don't have it in front of me. My doctor just ordered one where it helps with, I won't be able to use the Cavitron again or the piezo, but it has a mirror on it. Oh my gosh, what is it?
PureVac?
I think it is PureVac. Yeah.
Somebody put PureVac in the comments. Oh, we're getting a lot of PureVacs popping up.
Yeah. That's what we're doing.
Sorry, I was on mute again. Yeah, I wish I would have looked like the genius with all the friends that helped me out in the comments saying PureVac, but it came to me too late. In fact, I wanted you not to get that because I knew the answer would come to you very clearly about 5 minutes after this call was over.
Oh, exactly. Yeah.
So. Somebody said they heard a lecture the other day about salivary testing chairside, not only for periodontal pathogens, but for COVID-19. Maybe get a COVID clearance on patients before the SRP?
Huh. That's interesting. Yeah. I'm not sure. I don't know much about that, but I like the idea of it. We don't do salivary testing yet.
Anonymous says, what are your thoughts on coronal polishing?
I believe that polishing doesn't have a therapeutic benefit, so I do not think we're going to be, I don't know, it's going to depend, but we talked last time about not polishing because, again, it doesn't have a therapeutic benefit to the patient, and the aerosols just come off of there, so I don't think we're going to be polishing to start.
Perfect. And then somebody just said that there's COVID testing kits, but they're $110. ADHA says to do selective polishing is another comment that just came in. And then the last question or comment in the Q&A, Rochelle, and I think this might be my friend Sarah in disguise, says, and namaste, exclamation marks, and a ha-ha. So I still don't know what namaste means. I'll get that. I guess I'll Google that after this call.
It just means it essentially means the highest part of me greets or acknowledges the highest part of you is really all it is.
Throw us one. We can see you. Throw us a namaste.
Namaste.
There we go. So Caitlin, excellent.
All of it doesn't have to be woo-woo. There's so many other, like a lot of my online program, it's really not woo-woo at all. And really there's so many benefits of yoga. So I have a lot of people that are either spiritual or they are religious and they're kind of nervous about doing yoga, or the people that are like not flexible and don't think they can do it. I would say just give it a try, and it doesn't all have to be woo-woo. It doesn't all have to be for the flexible.
Definitely, and I apologize. I joke, but I've heard nothing but fantastic things about this, and I definitely want you all to reach out to Caitlin via her email. And then she's got a few of her Facebook group is on the screen here, and then some other ways to contact her and get through. The Rochelle wrote back and said, "Ha, this is not Sarah. This is just a Canadian RDH." So we have hygienist from Canada with us. That's pretty exciting.
Hey.
Let's see. One last question, and then we'll wrap it up. It says, for a setting with hygiene with assistant, could ultrasonic still be used? So if you had an assistant, would you be comfortable using the ultrasonic?
I don't think so.
Yeah, and and all that is you know, Caitlin, agree or disagree, personal preference. You're a hygienist, you're a professional, you know, you've got to be comfortable in your position in the office, and that's going to come via communication with your doctor to make sure that everything is on the same page.
Mhm.
So with that being said, that was fantastic. We had close to 300 people on the call. We still have a very large number still with us. Caitlin, again, everyone, I want to invite you to contact Caitlin through all the information here on your screen. For those that are listening on the podcast version, www.caitlinparsons.com. And then you can email Caitlin at support at that same domain name for the address. Somebody just said thank you for the insights. Caitlin, on behalf of everyone here, and they're putting the information in the chat, I want to say thank you so much. And I definitely want to support that these people reach out to you, become a part of your dental community through that Facebook group, and also could reach out to you to bring some more calming spirit into the office. I think that we're going to need PPE specialists as well as a calming specialist in these offices as we go forward. You've done a couple calls with me as a group, and as you know, I want to throw it over to you for the last 20 or 30 seconds to give us some parting words of wisdom and say goodbye to everybody.
Yeah, thank you all so much for being here, for asking any questions. I think the most important thing as we move forward is just to take care of ourselves, to take care of our families, to stay open and in communication, to be ready to pivot and to shift, to show up as a full team player, and we'll all make it through. One day, one breath, one moment at a time. It's going to be different. It might be challenging. There's going to be times that will be more challenging than others. So hang in there. If I can support you at all, if you have any questions, don't hesitate to reach out. But we've got this.
Yeah, it's excellent information, and that mentality. You know, I think it starts with individually you're comfortable, and then as a team, as a team going into that practice, you know, fighting this kind of invisible enemy. I think that, you know, the bonding that we do right now as a dental team, the understanding and the support that we show for one another is going to help us go back into these offices stronger than ever. And there's going to be some awkward, you know, paradigm shifts in what we do and some new procedures, but I definitely think that we'll get through it. You know, your message is great because it's just kind of an extra layer of calming. And especially everyone that's sitting home right now, is there any YouTube videos, or can they join you somewhere to do some relaxation exercises or yoga while they're sitting home waiting for these practices to open?
Yeah, I would say either email me or find me in the Facebook group. Again, I have the my monthly membership spaces. I actually just started it, and you can get on for $22 a month right now, and you get a few classes every month of some more gentle and therapeutic classes, and then a little more active. I have a really yummy, I can't wait to do it myself, guided relaxation with, actually I use the crystal bowls at the end, so it's just a really nice way to relax. So that's the kind of the lowest tier, is the monthly membership space. You can sign on and cancel anytime. Or I do have some free classes in my dental hygiene Facebook group to dive into too.
Awesome. Perfect. So there's more thank yous coming in. Caitlin, on behalf of all the people that joined this call, I can't thank you enough for the information that you've shared with us. Again, everyone, Caitlin's information's there if you want to reach out to her. You know, my parting words of wisdom are, you know, use this time to, you know, expand our minds, you know, join calls like this, create new communities, have conversations about what we're going through and what's going to happen going forward. Enjoy this time with your families. It's kind of unprecedented that we would spend this much time with our families, and stay safe and stay healthy. So with that being said, Caitlin, thank you so much. And I'm going to go ahead and end the call. And please reach out to Caitlin with her information here on the screen. Thank you.
Thank you.